There's a sexually transmitted infection that can live silently in your throat for decades and eventually develop into a very deadly type of cancer. Now, there is a screening test that can tell you if you have this very infection, but I own an STI testing company. I wouldn't sell you that test, nor would I take it as a patient. What we're talking about today is HPV, or human papillomavirus, more specifically oral HPV. But HPV has about 200 or so different strains, and it's been called the common cold of the sex world. It's been called the glitter of the sex world because it is so easy to contract and spread. As a matter of fact, it can spread through skin to skin or skin to mucosa contact, so not even condoms offer 100% protection. So it is extremely common. Now, the good news is that most of those strains of HPV are harmless so far as science knows right now. The one that we're talking about today is known as HPV-16, and when it infects your throat, it can eventually develop into something known as oropharyngeal squamous cell carcinoma. Now, I know that you probably go to the dentist twice a year, and that dentist grabs your tongue and has their flashlight and is looking all around for cancer, right? The truth is, this is a particular type of cancer that happens way back in the back of the throat in a place that those dental examinations generally cannot see, nor is there much to see to begin with, which we're going to talk more about in just a minute or two. Now, I said earlier that I wouldn't offer this test. The truth is, I cannot find a cancer association, foundation, university, government agency, public health department that don't do anything but tell people not to get these tests. Now, I want to reiterate, because this is really fascinating, I think. There is a sexually transmitted infection that, if in your throat, can eventually turn into a very deadly type of cancer. And if you do not have this sexually transmitted infection, it is extremely unlikely that you will develop this particular type of cancer. The STD is primarily the thing that drives the change into cancer. And there's a test that can tell you if you have this infection, yet everybody's saying not to get it. Why? Well, there are many great reasons why not to. And the first one is that very few of these cases turn into cancer. Remember earlier when I said that HPV is like the common cold or the glitter of the sexual health world? Tie this one on for size. About 7% of the population in the United States has oral HPV right now. I didn't say had it at some point in their lifetime. I'm saying right now, 7%. But the good news is that less than 1% of those cases are HPV-16. And the even better news is that less than 1%, in fact, far less than 1%, of that 1% that have HPV-16 are ever going to develop into cancer. And that is exactly why the Oral Cancer Foundation, who they clearly do not want you to develop cancer, says the foundation feels that while these tests find infections through a well-recognized testing protocol, since only about 1% of individuals that develop a high-risk type oral infection ever cascades into cancer, and that most often occurs decades after infection, that the utility of these tests is highly in question when it comes to providing meaningful and actionable information. Meaningful and actionable is what you need to focus on now, because whenever I tell people that yes, lots of people have oral HPV, but very few of those people are ever going to develop into cancer, then people think that the reason that government agencies and such recommend against this testing is because of money. Well, we just don't want to spend any money to save people lives. But that's not it. It's because there is no actionable next step. And that actually brings me to pap smears, because you have probably had a pap smear if you're a woman, or maybe your wife or your girlfriend or your daughter. Somebody in your life gets pap smears, believe me. And you may or may not know that during that pap smear, they often check for HPV. Why? Well, the big difference there is that while HPV-16 can cause cervical cancer, there are also precancerous lesions that they can examine, keep an eye on, do a biopsy on, etc. You cannot do that with oropharyngeal squamous cell carcinoma because there is no precancerous lesion, and it's critically important that you understand that. Now, this next part is going to make some of you really uncomfortable, and I'm sorry about that. But unfortunately, with this particular type of cancer, the first sign of this particular type of cancer is very advanced cancer. It's going to be something like the person is shaving and feels a lump in their throat, or somebody's putting on makeup and feels a lump. And unfortunately, by that time, it is just very advanced cancer and very difficult to treat. What I've heard people say who defend these tests is, well, if it's positive, then, I'll keep an eye on it. You're going to keep an eye on what exactly? You can't really see back there. And even if you could, there's not really anything to see. There's no precancerous lesion, unfortunately. It's just the simple truth of the matter is that there's basically nothing that you can do. And that is exactly why the United States Preventative Services Task Force, which is the government agency that basically weighs the pros and cons of all screening tests in the United States, that although there is interest in screening for oral HPV infection, medical and dental organizations do not recommend it. And why the American Cancer Society says there are commercially available oral HPV tests that are not yet FDA approved or included in screening guidelines. The American Cancer Society also notes that there are no HPV tests that can determine somebody's HPV status because HPV can infect different parts of the body and an HPV test result can change over a period of months or years. So let's talk about three things. Why wouldn't you just get this test anyway? Why do some dentists and labs sell them even though basically everybody recommends against them? And perhaps most importantly, what can you actually do to protect yourself from this particular type of cancer? So why wouldn't you just get this test anyway? Well, it's simply because there are some tests that do more harm than good. Look, in a best case scenario, this is just going to cause you a tremendous amount of anxiety with absolutely nothing that you can do about the outcome of if this is going to turn into cancer or not, except the two things that I'm going to tell you about at the end of this video. And you know, this isn't uncommon. If you go look at the federal guidelines on screening tests, you will find a lot of tests that theoretically could find something and theoretically could save your life, but the potential for them to do you harm is just simply too high. So the second question is, why do people offer these for sale if basically everybody agrees that they're not helpful and that in some cases they harm people? Well, I don't want to completely discount the fact that these dentists and labs that are selling these, there's probably several of those people who feel like these truly do help people. And there's a whole group of people who say, you know what, this kind of take this libertarian stance of like, it's your body and you should have all the information about it that you want. I'm sure that is true. But the simple fact is that I could not find a single dissenting voice from somebody that's not selling these tests that these things are a good idea or help people. Third, and most importantly, is how can you actually protect yourself? Well, first and foremost is the HPV vaccine, which has caused cervical cancer rates to plummet. And experts think that although it hasn't happened yet, that rates of oropharyngeal squamous cell carcinoma are going to plummet as well. The truth is that this particular type of cancer often takes decades to develop. That vaccine was just released and only to girls in 2006, later on to boys. So unless you're like 30 years old or something at the moment, you probably didn't get protected from this particular vaccine. However, in most cases, you still can. If you just didn't get it as a young person, but you're less than 45, run off to the doctor right now and try to get this vaccine. They should be able to do it, and they should be able to get it covered by your insurance. If you're over the age of 45, it's a little bit more difficult, and I'm going to put a link right here in the description. Sign up for that email list, and I will send you an article on how to get that HPV-16 vaccine if you're over the age of 45. But the other thing that you can do is not smoke and not drink. Both of those things have been proven to increase your risk of oropharyngeal squamous cell carcinoma if you also have HPV-16 by about 160% for both of those. So yes, having HPV-16 is the main risk factor. However, these other things are what really make you much, much more likely to actually develop cancer. Well, remember, here at Shameless Care, we sell STD testing. And as a matter of fact, I could have made this entire video, tweaked it slightly, and scared the hell out of you when it comes to HPV-16 and oropharyngeal squamous cell carcinoma, and probably sold a lot of tests. But what I do at the end of the day is just simply try to understand what the experts are saying, read the scientific research, and communicate it with other people. And I don't sell anything just for the sake of selling things. I only sell things that I truly believe are helping people. Now, if the science changes on these tests in the future, then we will be the very first, well, not the first, the very first after the data changes to offer it to customers, patients, etc. Well, my name is Robert from Shameless Care. Thank you so much for watching, and we'll talk soon.